Welcome to CareLink SF, eClinical Works, EMR Training, Resident. Learning objectives: setting your office visit screen to view scheduled patients, accessing an overview of the patient's medical record, updating the appointment provider, and resident workflow. This is your office visit screen. As a provider, this will be the default screen every time you log into ECW. Appointments are scheduled under Resources, so you will need to select your resource in order to view your schedule for the day. To view your schedule, click on the ellipses next to the Provider Resource box. From the drop-down, select All Resources, and then choose your resource from the options below. Refer to your clinic to find out what resource you will be using to view your schedule for the day. Some residents or fellows may have their own resource codes. For example, for continuity residents, your resource may simply be your last name. You may also use your attending's resource if you will be seeing patients on his or her schedule. Other clinics have shared resources. For example, at 3M Orthopedic Specialty Clinic, your resource may be Ortho Gold. Once you've selected your schedule, adjust the viewing preferences as needed. From your schedule, you will be able to see which patients have been registered and checked in, which will be noted by the green Arrived Visit status. You will also be able to see which patients are ready to be seen from the status column, as well as which room they're in. Once the status changes to ready, the patient is ready to be seen by the provider. Confirm the provider resource column is populated with the appropriate appointment provider. Labs and diagnostic imaging results, as well as prescription refills associated with this encounter, will return to whoever is listed as the appointment provider at the time of ordering. On your first day of clinic, verify with your clinic supervisor who should be listed as the appointment provider. Some clinics will have you listed as the appointment provider, while other clinics will have your attending as the appointment provider. This is to ensure that all test results and prescription refills return to the appropriate provider to review. For this scenario, since I'll be viewing my schedule under a shared resource like Ortho Gold, after checking with my clinic supervisor, I'll go ahead and update the appointment provider from Physician Statistical to the appropriate provider. You can do this by checking the box to the left of the patient, then clicking on the caret next to View Progress Note, and select Change Appointment Provider/Resource. Click on the ellipses next to 2, and search for the appropriate appointment provider. Click on the caret next to View Progress Note again. This time, select Claims Provider. Verify or update the supervisor field to your attending, and update rendering to yourself. CareLink SF does not value the Pay To field, but it's worth noting that when you update the supervisor field, the Pay To field will update as well. To indicate to your staff that you are with the patient, change the status to Provider. Double-click on your patient to open the progress note for today's visit. First, let's take a look at the patient's medical record information. The Encounter drop-down on the right allows you to scroll back to previous ECW encounters. T is a telephone encounter, and V is a face-to-face visit. The patient's dashboard consists of some basic information, such as the patient's name, address, PCP, preferred language, and if a translator is needed. The patient hub functions may be accessed here. You can access alerts for healthcare maintenance tests that are due for the patient, labs and X-ray results, encounters, flow sheets, and more. You may also view and merge patient's medical record information from the right chart panel. Click on Overview to access the problem list and medication summary. DRTLA to merge reviewed results and history. Now we'll begin the resident workflow. This workflow example is not specific to any clinic. Clinic roles and workflow process may differ from clinic to clinic. First, verify a final time that the correct appointment provider is listed on the note. We'll work our way down the note, beginning with HPI. Depending on your clinic, the nursing intake information may vary. To free text finding and discussion, click on HPI and select Interim History. Text your notes into the Notes section. Close out, and you will see your notes populate here. Next, verify current medications. From the right-hand side, select Taking, Not Taking, Unknown, or Discontinued. To add medications, add in the green box, select a dosage. To make adjustments to a current medication, double-click on the medication and adjust here. Once you have updated and reconciled the medication list, select Verified. You also have the option to apply status from prior visit. You can view past RX history or external RX history. Close out of this window and the current medications will populate your note. Update medical history. Click Add to add any new history. Next is Allergies. Current allergies will be listed in the note. To add a medication-related allergy, click Browse RX. And then complete the reaction, type, and status. To add environmental allergies, click Add and select Unstructured from the drop-down. Free type or choose from the drop-down to add the environmental allergy and complete the reaction type and status. When you have finished verifying the allergies, select the Allergies Verified box. As a side note, you may navigate through your progress note by using the icons above, which correlate with each of the blue links on your progress note. You can hover over each icon to see the different sections, such as Med Reconciliation, HPI, and Treatment. You may also select Encounter or Physical drop-down menu to view the sections of the progress note. The bottom left and right buttons will also allow you to access previous or following sections of your note. Close out of this box, and you will see your information in your note. Next, we'll review the different history sections of the note. First, review the history from the History tab in the right chart panel. If you would like to add any information to the history as discussed with patient, you can do so in your note. Click on GYN or OB History to review and update any general notes in regards to menstrual, sexual, or contraceptive history if discussed with the patient. Review and document any past surgeries. Click Add to add any new surgeries. Add the date and surgery. Hospitalization. Add the date and reason for hospitalization. Close out or navigate to the next section of your note. For family history, you can view a list of family members on the left-hand side. You may update their health status accordingly. By documenting the year of birth, the system will automatically calculate the age. The Notes section will allow you to document any notes in regards to this family member. Otherwise, you may check off which chronic conditions apply to this family member, as well as the date they were diagnosed. You also have the General Notes section at the bottom, where you may free text any information. Navigate by closing out or clicking on the Social History box. Here you may update any notes in regards to the patient's living situation, country of origin, patient's strengths, or other aspects of social history. And add any general notes if needed. Close out and view your updated history in the note. Next is Review of Systems. Click here and the symptoms will appear on the left. Click on the green arrow to add denies to the related symptoms. Click again to change it to complains of these symptoms. You can click on the Notes section and add to the pre-populated notes. You can save default ROS for yourself by clicking on the caret next to Default per category. Click Save As, and then name this ROS for future reference. And for future encounters, you can access your favorite ROS by clicking on the drop-down and reviewing a list here. Close out and view your ROS in the note. Now we can begin the objective portion of your note. Vitals will be populated by the intake nurse or MEA during intake and will be available here for your review. Out-of-range vitals will appear in red. Past results. Here, you can merge previously resulted labs into your note. To do this, click on the DRTLA tab from the right chart panel and scroll down to find the lab that you would like to merge into your note. Only reviewed labs can be merged into your note. Unreviewed labs will appear with a square. Reviewed labs will appear with an arrow. The first arrow will merge a single lab result into your note, and the second arrow will merge multiple lab results into the note. You can click on the pink paperclip next to the lab to view the lab results. Then click on the arrow if you would like to merge that lab. Vision examination is used in some specialty clinics. Examination defaults to the adult general examination. This window functions just like the Review of Systems window. You have the field of the examination on the left, the arrow to add default results, and observation notes. You can save default examinations for yourself here, just as in the Review of Systems. You can also use the Notes section to free type below. Close out to view your examination in your note. Next is physical examination. Physical examination is used as a placeholder for your attending physician's attestation. If presenting the patient's case to your attending, he or she can merge the appropriate attestation template here. and document any additional pertinent information. For example, as an attending, I would merge the appropriate attestation template from my right chart panel into the progress note. I will then be able to click on the in-room resident supervisor link, timestamp my name, and document any pertinent information. Click on Assessments to add a diagnosis or assessment code. When you first go to the assessment window, make sure that you're in the Smart Search and not the Classic Search. When adding assessments, make sure that you are adding ICD-10 codes to your note. ICD-10 codes generally begin with a letter, while ICD-9s generally begin with a number. Ensure that the Use ICD-10 is selected, type the assessment or diagnosis, and click Go. From the results, choose the appropriate diagnosis. If the ICD-10 code is blue, it will serve as a link to a more specific diagnosis. Click on this link to increase specificity. Continue adding assessments. Click on the diagnosis if you would like to add it as is. You can choose from this patient's previous assessments or from their problem list. When you do this, make sure that the auto map to ICD-10 is selected, because some of the previous assessments may have been added before the ICD-10 transition. Also note that if you bring previous assessments in this way, they may have notes attached to them from previous visits. Check the Notes section here to see if there are any notes attached to this assessment. Select the primary diagnosis for the visit. Select PL to add the assessment to the patient's problem list. To remove an assessment, click on it and click Remove. To document your assessment notes and plan, you can text in the Notes section next to each assessment, or in the Notes box at the bottom. You may also add assessments to your note from the problem list in the right chart panel. Make sure that the problem list has been updated to ICD-10 codes if you do this. Click on the arrow next to the diagnosis you would like to add. These assessments may also bring in notes from the previous encounter. Now that you have added assessments, you can order medication, labs, diagnostic imaging, and procedures linked to each assessment. You may place your orders in the treatment link or by using an order set from the right chart panel. Click on Treatment. This is your one-stop shop for all orders. Notice that each assessment you have added has its own tab for orders. Medications. For refills, click on Current RX. Select an assessment that you are ordering for from the left side. Find the medication you would like to refill. Here you can continue, refill for 30 days or 90 days. You can stop the medication. When you're finished refilling, click OK. When prescribing medications, the drug-to-drug interaction window may pop up to alert you of any possible drug interactions in the patient's current medication list. Scroll down to view all the interactions and their descriptions. Close out when you are finished. To adjust the duration, dispense, and refill, click on the medication and adjust here. Click Apply. For new medications, select Add. Select the assessment that you are ordering for and type the name of the medication. Select the medication from the drop-down. The smiley faces next to each medication represent whether or not the medication is covered by the patient's prescription plan. And then click on the pen and paper to adjust the prescription. Once you have ordered all of your medications, click on the arrow next to Send e-prescription and select Fax or e-prescribe. To e-prescribe, verify that the correct pharmacy is selected. Change the pharmacy here. You can add notes to the pharmacist. Verify the correct medications are selected and select Send e-prescription. For residents without a DEA license, your attending will need to send your prescriptions. In this case, attendings may log in and change the appointment provider to him or herself and send the prescriptions. Be sure to change the appointment provider back to yourself after the prescription is sent. Ordering tests. When placing orders, it is important to link the order to an assessment. To order labs, click Browse. Assessments that you have added will be on the left. Select the assessment that you are ordering the lab for, and then search the lab to be ordered. To continue ordering for other assessments, change your assessments from the left-hand side. You can also search by aliases, such as PHL for Public Health Lab. To order the lab as a future or reoccurring lab, click on Future Orders, add the lab, and change the date to the date the lab will be drawn. For reoccurring orders, click Add Standing Orders, select the number of orders and the duration. We'll order 5 labs once every 6 weeks. Certain labs and diagnostic imaging will require Ask on Order questions that will appear when you click OK. These questions must be answered in order to carry out the order. Your orders will appear under the corresponding Assessment tab. To order diagnostic imaging, click Browse. Diagnostic imaging will always appear under today's orders. Choose your assessment that you're ordering for and search the diagnostic image. To order and document any in-house procedures to be completed during today's visit, you may click Browse under Procedures, select your assessment from the left, and search your procedure. We'll do an albuterol nebulizer treatment. Click OK. To assist in ordering, you have the option to use order sets. Order sets are a group of treatment options, including prescriptions, labs, diagnostic images, and procedures. They can be specific to a diagnosis or a clinic. Your favorite order sets will be saved and available in your right chart panel. You can access a link to all order sets available in DPH by clicking on the red OS. The drop-down will provide you with a complete list of order sets. When you have found an order set that you would like to save, click on the yellow star to add to your favorites. This way, the order set will be available to you in your right chart panel at all times. To order from an order set, select the gray OS next to the order set you would like to use. Select the order that you would like to place and click Order from the top of the screen. Notice all the orders you have placed will populate the treatment section of your note. From the treatment link, you can access outgoing referrals. Here, you can create in-house referrals, for example, to your clinic's social worker, or out-of-network referrals, for example, to UCSF. From the ellipses, search for a specialty or physician. As a mandatory field and for tracking purposes, select your name or a designated staff member in the Assigned To field. Document the reason for the referral. Be sure to add relevant diagnosis codes and procedure codes. To attach additional documentation to the referral, click Attachments. Here, you can add progress notes, labs, and additional documentation. To send the outgoing referral directly, select the caret next to Send Referral and select Print with Attachment or Fax with Attachment. Or, if prior authorization or additional documentation is needed, leave the status as Open and assign to the appropriate staff member. You may also document general notes or clinical notes and attach to the referral. Click Save when completed. E-referrals are carried out by accessing an outside link available in the Patient Hub. Click Hub from the top of the screen, and then click on the SFDPHE link and Submit E-referral. Document the e-referral in the Treatment Notes section. To print patient education from the treatment window, click on Education. You can print patient education or prescription education. This will take you to the HealthWise website. Based on your assessment codes, you will see Suggested Education on the left. Education with a global icon is available in multiple languages. You may print the documents if necessary. You may also search for additional patient education using the New Search tab. Next is Immunizations and Therapeutic Injections. Click on either of these links, and Immunizations will appear at the top of the screen and Therapeutic Injections at the bottom. To add an immunization, click on Add, type the immunization, leave it as pending to be administered by your discharge nurse or MEA, and click OK. Therapeutic injections can be ordered the same way by clicking Add, the immunization or injection will appear on the note as pending. Visit code. This window will provide you with a summary of all the assessment codes used in the visit. Here, you can add or remove codes. Make sure that you have a primary diagnosis selected for the visit. Next, click Add E&M, and depending on the complexity of the visit, the E&M code will vary. Add relevant CPT codes. Document your follow-up appointment requests here. Note that some clinics create an action for a follow-up appointment request and assign it to the front desk staff to be scheduled. Refer to your clinic workflow for communicating appointment requests. If you have completed all of your documentation for this note, you can click Done. To print a copy of the visit summary for the patient, click on the caret next to Print. Select Print Visit Summary and select the categories that you would like to appear on the visit summary. And select Print Preview and print. This completes charting in the progress note. You will need to return to the office visit screen to update the patient's status. If the patient needs to be seen by a discharge nurse to complete orders, update the status to either ORD-DC, nursing staff to complete orders and discharge the patient, or ORD-RP, for nursing staff to complete orders and return the patient to you before discharge. If the patient does not need to be seen by a discharge nurse or front desk staff, check the patient out of the office visit screen and the resource schedule. To do so, from the office visit screen, select the patient, and then click Check In, Check Out from the bottom, and select Check Out. To check the patient out from the resource schedule, click on the resource schedule from the left chart panel. Double-click on the patient's name and change the visit status to Checked Out. If your attending is listed as the appointment provider, be sure to change the appointment provider to yourself before locking the note. Lock the progress note once all documentation is complete by selecting the caret next to Lock and selecting Lock Modern 3. All notes must be locked within 72 hours of the visit. Here's a preview of a locked progress note. Assign your progress note to your attending to cosign. To assign the note, click on the caret next to Details, select Change Assigned to, and input your attending's name in the To field. You may add any notes in the Notes section. Thank you for watching ECW's Resident Workflow video. For questions or suggestions, email us at carelinksftraining@sfdph.org.